Hello, everyone. Thanks for joining us. I'm Maya Autre. I lead communications for ISSA, and today I have the privilege of interviewing my dear colleague, Mihaela Ionescu, who is our program director at ISSA, and she is the author of a recent report called Increasing Participation in Early Childhood Education and Care in Europe, published this year. It was produced by the Expert Network on Economics and Sociology of Education and Training, shortened as ENESET, in collaboration with the European Commission. So what this report does is it takes stock of the state of early childhood education and care across the European Union, focusing especially on participation gaps among vulnerable groups, including children under 3, children from low-income families, migrant or Roma children, and children with disabilities. It highlights key policy measures to improve access, affordability, and inclusivity, quality of services across countries. So now we get to explore with Mihaela about the findings, the policy implications, and what they mean for practitioners and policymakers, as well as organizations like ours working to strengthen ECEC systems as a whole. So, Mihaela, let's hear from you. Why this report and why now, please?
Well, Maya, we are at the moment when Europe has made strong commitments to young children, from the European Child Guarantee to new EU care targets. Yet the children who benefit the most from early childhood education and care are still the least likely to attend. So the aim of the report was very simple: to understand what actually helps countries close these participation gaps. We wanted to move beyond general principles and look at concrete measures that make a real difference for families, especially those that face poverty, discrimination, or other risks. The timing is important because many member states are now revising their plans for expanding early childhood education and care for the youngest one, and this evidence can help ensure that expansion is equitable, not just bigger.
Thank you. So, but why focus on children in vulnerable situations and children under 3 in particular?
Well, because this is where inequalities are the deepest. Children under 3, especially those from low-income, Roma, migrant, or other vulnerable families, have lowest participation rates in Europe, and the gaps are actually widening. Yet we know that the first 3 years are a decisive window. High quality experience, early experience in this period can transform a child's development and can reduce the inequalities before they can really take roots. So focusing on the youngest and those who face the greatest barriers, it's a rights issue, it's an equity issue, and it's a smart investment.
And so, speaking of barriers, what are the common barriers to participation that you saw across countries?
Despite very different systems, I would say that countries are actually facing many same obstacles. Primarily, there are not enough places where vulnerable children live in the communities where they live. And I mean here by poor neighborhoods or remote or rural areas. Also, that costs are still too high for the low-income families. And we include here the hidden costs, like meals or transport. The late legal entitlements in many countries, a guaranteed place, it's available only at age 3. Also, policies are unintentionally discouraging enrollment with the like the home care allowances that actually are encouraging to keep children at home longer. And finally, the issue of trust, of discrimination, or too complex procedures that make it hard for families to navigate the system. So these are combined barriers, and they explain why universal expansion, as it happens in many countries, I mean, the trend is towards universal expansion, has not automatically meant universal inclusion.
Well, so despite the fact that there are common issues across countries, I imagine it's still very complicated to find a one-size-fits-all solution, and it is a complex moving puzzle. What would you say were surprising differences between countries?
There are many, and some are quite revealing. Some countries, for example, guarantee a place from the end of the parental leave, and that's a very important aspect. Other countries are providing services only from age 3. Some offer free access or they offer strong subsidies, while others rely heavily on families, on their affordability to provide children with a place or to attend the services. And some countries actively actually prioritize vulnerable children in admissions and ensure that they don't end up at the back of the queue, while others take a first come, first served approach, which actually favors the most advantaged families. So these are just a few differences that could be noticed across countries. And these differences actually are showing that choices in policies matter. The systems that combine early entitlements, affordability, and target support tend to achieve higher and more equitable participation. So it's not a one solution, it's a mix of policies that actually are leading to increased equity.
So a policymaker reading this report hopefully will see lots of opportunity, good practices, and can identify ways that they can make things better, and they have, hopefully. Okay, so we've focused a lot on what the problems are. What are measures that appear most effective for increasing participation among vulnerable children and those under 3 for our policymakers to help themselves?
There are some measures that actually are, I would say, that refer to the entire age group, yes, from, let's say, end of parental leave until entering primary school. But there are some that are a bit more specific for the under 3s, which, as I mentioned, is one of the systems, subsystems, where we witness the widest participation gaps. But among the results, I would say the strongest results are coming actually from a package of measures rather than a single solution. And such package might include guaranteeing access early, ideally from the end of the parental leave, making services genuinely affordable, which means either with a free or a strongly subsidized place, prioritizing children who need most support, either through reserved places or clear admission criteria, so that they are the ones that are prioritized. Offering outreach and bridging services, such as PlayHub, parent-child groups, such kind of community-based, non-formal services that are actually helping families build trust and offer a smooth transition into formal early childhood education and care. Also, lastly but not leastly, ensuring quality so that families feel confident that their children will be welcomed, supported, and feel safe, because many of the families that usually are not benefiting with their children of services of early childhood education services are also doing because of mistrust that actually children will benefit of high quality services. Well, these measures are combined, so that means that participation might rise, but more important, that inequalities might shrink.
Okay, so taking a package approach is better than trying testing out just a single solution, and some of these elements seem a little bit more challenging than others, such as offering outreach might be more complicated than, say, something else. But going back on the question of quality, because most of this is focused on access, what about quality does the report say?
And actually, I think this is one of the points perhaps that is very clearly underscored in the report, that expanding access does not make a huge difference if it's not paired with strengthening quality. Quality is essential, and for vulnerable children, attending a low-quality service, research already has proven that can actually widen the gaps instead of closing them. So the report is highlighting the importance of qualified staff, inclusive pedagogy, and of creating environments that feel safe, trustful, and welcoming, not only for children, but also for families. It also emphasizes that the services that are provided for many vulnerable children need extra support, which means additional staffing, coaching, targeted funding, or even specialist services. Otherwise, they risk creating a two-tier system. And expanding access without investing in quality is just simply not enough. We have already learned about this, and actually it's something that has to be prioritized from the moment that we are trying to address the issue of participation gap. For not having collateral damages, actually, that's the risk that we have to very much consider when addressing the inequity and participation gap.
So the quality is as important to the ensuring the trust as well as the quality of, meaning access alone doesn't do it, and quality is also important for trust. Okay, understood. So now we know that there is definitely a shortage of staff, of budgets to support staff, of budgets to ensure quality, training for staff. How do countries expand access while also protecting quality, especially with the limited staff and budgets?
Well, it's not easy, and obviously the key is to expand strategically, not rapidly. I think that's one of the principles, I would say, that might lead to visible outcomes, not on a short term, because we never talk about short term, I would say, in fields as education. Investing first in the communities that where the greatest need is recognized. I think that's one of the, I would say, priorities in the way that the strategies are shaped. Linking every new place to minimum quality guarantees, so especially staffing. So as I was saying, quality is crucial, especially for the most vulnerable. That means that while we concentrate in places where to create availability and accessibility and affordability, then next step would be to create a place where quality, competent professionals are working, which means that the investment in capacity building, training, working conditions, and career pathways for those that would work in such services need to be guaranteed. Also, another, I would say, element that is crucial in thinking on how to provide expanded access paired by quality is to use flexible and part-time and non-formal options as complementary stepping stones, not replacing the formal education. These are, as we know, creating services that, formal services that comply with the national standards might take time. And as I said, it's not about how fast, but how good the services are put in place and provided. Until that types of solutions are possible, feasible, because of financial reasons also, such kind of flexible solutions are part of the solution, general solution for without compromising quality, as I said, and seeing them as temporary solutions until children can benefit from formal education, as all other children in the very specific country are benefiting.
So an important two important takeaways for me from this, if I understood correctly, is that you first want to target the more vulnerable communities because what could work there could work everywhere else, and that's not necessarily true if you do the inverse, which is support the more privileged areas and try to retrofit it in the vulnerable communities. And also that having more pathways for more profiles, more people to get involved at various stages in various capacities is important to a strategic phased approach that can slowly build up the quality and the access for young children. Okay.
And resourcing these flexible solutions or temporary solutions, I think that's equally important. Having qualified professionals that provide quality environments with the flexible program, but definitely able to interact, communicate, partner with families and the community so that children and families feel that they are supported, and it's a community led, I would say, endeavor to support those families.
So the temporary solutions, because some might say, well, why start up something temporary? It helps build trust. It also helps prove a concept. It's a low barrier commitment for legislators or local municipalities to invest further in expanding access and quality locally. Okay.
Yes, there are many examples already across Europe. I think this has become as a result of trying to respond to a challenge. As I don't think that one size fits all. It's something that we can still consider as being a possible scenario with a diversity of needs and complex challenges that with intersectional vulnerabilities that many families are facing. And that's something that obviously one type of service might be difficult to meet, which means it's not just about reconsidering how the services are provided, but also how services are collaborating, coordinating, so that they surround children and families, especially those that are in the most vulnerable situation, as that they would require additional type of assistance, support, and stewarding.
So the intersections could include both poverty and coming from a specific social group that's more discriminated against, disability, and
Exactly.
then it's important that across sectors, there's more coordination in terms of services between health and education, et cetera. Okay. So lots going on. The question is what does this mean for NGOs, civil society organizations, and networks like ours? Because from what you described, it sounds like there's not a one-size-fits-all solution. However, there are some kind of things that transverse across different situations, and rather than each community inventing it from scratch, what can be commonly applied, or how can we help in terms of organization like ours?
I think that in general, the NGOs, the civil society organizations, and networks like ours, national networks also, they have a critical role. They are often the ones that are the closest to families, to communities who face the biggest barriers, and they can build much easier trust. They can provide outreach, which we just mentioned that it's something that is quite challenging for systems. They can also be the ones that are running programs or such type of flexible services, parent-child groups, or parenting support for Roma or migrant families. But they also can help create this link between formal education and social and health services. They have been for a long time, I would say, and continue to be the ones that are training a lot of professionals. They pilot innovative approaches. There are lots of European funded projects that have been the ones that mobilized a lot of knowledge resources in trying to create new solutions or valid solutions or long-lasting solutions, scalable ones, to give an answer to the many challenges that services also are encountering, as well as families. But they also bring real-life evidence into policy discussions. Lots of projects are ending up with either knowledge products or I would call them prototypes of programs, but also with policy recommendations. And many of them perhaps are sitting in different places, but many of them have been the ones that led to all this understanding where we sit, what's not working, and where we should be, and actually what works a lot in trying to increase the trust, the availability of services, and to make the relationship between services and such families a more generative, I would say, relationship that brings outcomes for children. Well, this bridge between families and institutions, it's essential, and I think NGOs have accumulated a wealth of experience. It's a lot of, they really hold a know-how space that is to be leveraged in systems, and many times they are a source of innovation.
So the NGOs, organizations like many of our members who are doing this work, they are on the ground with communities, have established trust, have established well evidenced practices and outcomes. And so if a municipality or a ministry wants to invest in some of the examples that we gave earlier, then they could be a really good partner to do so. They have the know-how. There has been defunding in the field, which jeopardizes all this important, valuable knowledge. And so more than ever, it's important to partner, especially given that there is a more pressing need than ever to balance these inequities. Lots of possibilities. Question going back to our policymaker friends. What are some main levers that can help close the participation gap?
I think that the report kind of summarizes, and I would just make a summary of those types of policy highlights in terms of what could be the powerful levels in making an effective policy. First one is about early legal entitlement to a place. Again, having an entitlement does not necessarily guarantee that children will be able to attend. That is strongly linked with affordability policies. The fact that they are available does not necessarily make them affordable. Third policy measure would be targeted expansion of services in deprived areas. So to go where the need is the most and resource those places adequately, so that you guarantee not only access but also quality. Another powerful level will be the priority access for vulnerable children, so prioritizing them. Another important one is workforce capacity building and support, because sometimes this is one of the weakest link, I would say, that there is either a staff turnover or there's a staff shortage in such type of places. And the last one, because there's a wealth of research already indicating how important it is to have strong coordination across services, not just education, who can carry as much as they can in terms of supporting families, but obviously there are multiple needs that are to be addressed by other types of services, such as social protection, social assistance, or health services. So better coordination across these services. So legal entitlements, affordability, targeted expansion in places that need the most, priority access for vulnerable children, workforce strengthening and support, and better coordination. Not every country can do everything at once, that's obvious, and all these are requiring not only funding, but also a strategic phasing process. But even starting with the few ones of this measure can really make a difference. So I'm not saying necessarily one at a time, but at least to start with those that can be put in place in a fashionable way, even considering how this can be scaled from a smaller region to nationwide scale.
Okay, so and in this case, I mean, because it sounds like a lot to do, so here I remind our policymakers that what we remind ourselves every day, that you don't have to do any of it alone, that the more you collaborate with others, the more you can get done. So partnering with civil society organizations, for example, on the capacity building, or even an institute like ECOS that allows for self-paced trainings that can be free, subsidized, or even for low pay, that can reach further regions, bigger audiences, so that we build the workforce. But all of these solutions also have been tested in different areas, and there are ways to look to see what works best for one's own contextual needs. So lots of possibilities for improvements.
Indeed.
That's promising. How urgent is it to tackle gaps for children under 3 in particular?
Extremely urgent, I would say. I think that we are in a period of time in the development of the science of ECD where we don't have any more doubts how important this age period it is. And this is also the age group, particularly birth to 3, where the gaps are the largest, but also where the benefits of actions are the greatest. So it is extremely urgent to address this participation gap. If we don't address it now, inequalities can become locked in before children even reach kindergarten. So it's I would say, social responsibility that we all share. And since this might take time, I think we can no longer postpone or delay or consider that it will happen by itself. Or if we just invest in just one small element in the system, it will fix the other weaknesses in the system. There is also a risk for parents. I mean, we know about this, and it has been one of the functions of the early childhood education and care that frees particularly mothers, of the time, and they can go back to work, or they could just benefit from professional development to improve their career path and so on. So if such services are not affordable, not only unavailable, but also unaffordable, that does not help. So having a clear, articulated, strategic way of understanding how the policy measures are interacting to provide an outcome that we are expecting is so important. So expanding the network of services will not be sufficient if we have a parental leave that does not encourage mothers, perhaps, to benefit from having affordable places. So this is both a child development issue, as we mentioned. This is a window of opportunity in their development that can hardly be recuperated, or can, but it might cost more in the life of every child, of every individual, that we don't have any right to take it from them. But it's also a wider social and economic problem. So connecting all these interdependent policies, I would say macro policies together, it's a way of understanding how precious is the investment in services that are targeting young children, the most vulnerable ones, and their families.
So by investing in the under 3s, you're getting a better return on your investment in general, and you're also addressing many more issues than just the one about access to care. And I would say, an important for policymakers who would take this. An important aspect is also awareness raising, because I feel as a mother that until they turn 3, nobody's talking to you except maybe the pediatrician, and it's all about you taking care of your child, as opposed to thinking that from birth my child is part of a larger society and social environment that includes services and options, especially because earlier on than we realized, children already need to start socializing, and it's important that they do so in a quality environment.
Learning starts at birth. And luckily, the situation you've described is not everywhere. So there are countries that I think that they have a higher level of awareness of the importance of this age group. But I think in general, the issue of early childhood development is not highly prioritized as a societal engine for development. It's seen still is low toned, I would say, in terms of how important it is as I would say a common commitment, a multi-party commitment to the future. I mean, to the present, but also the future of society. So it's something that because of the longer term that it takes and the visibility of the outcomes that are not immediate, downgrades them, I would say, in seeing as one of the key key aspects in the development of a society. And here we are losing, I would say, a human capital. Not only we are feeding into challenges that will become hard to, and a cultural reproduction of inequalities and injustice that we are becoming all part of it.
So the sooner we do more from birth and on, the better off we'll all be, because it does take a village and a whole planet, I guess. So on that point, where's more research and data needed, hopefully to make even more a compelling case and to raise more awareness?
I would say that we need a clear picture. I mean, in terms of data, we need a clear picture of who participates in early childhood education and care, especially under 3s. In general, the disaggregated data, broken down by income, migrant, disability, and other aspects of vulnerability. At the national level, it's not always easy to be found, which makes it difficult perhaps to strategize and also to see where the pockets of intersectional vulnerability sit, so that where the intervention should be more intense. We also need more knowledge about the quality of experiences that children actually receive in formal and how non-formal services can be scaled sustainably. So if we're looking at the solutions for these groups of children, obviously we need to look which solutions work well, and then to see how we can possibly consider scaling them up sustainably. This is a part of research that I don't think that it's yet covered, as well as to get more complicated, to bring more evidence how packages of policies are working together. So where does the strongest impact lies? There is some, but I think that's not sufficient. In general, I think there's not sufficient investment in terms of research that is focusing on youngest children, and especially on how the coordination across services actually brings higher impact on the outcomes for them and for families.
So more consistent quantitative and qualitative analysis of what is being administered and what the outcomes are, but also in terms of what implementations are being done and how effective they are. Okay.
I think we reached a point where we mentioned that one size does not fit all, and we might get tired of all this phrase over time, but given the diversity of challenges and context, we have to understand that while the formal system has its own benefits, we have to consider which part of it would need to change to adapt to the times that we are living, one. Secondly, what other solutions are out there that could be satellite solutions that would improve the outcomes for children, and how different kinds work together. We need to be more flexible in the way that we are understanding how services should be delivered, because it's obvious that the traditional way of delivering, it's not working and has led to widening the participation gaps. So while it works for certain types of groups, it's not obviously working well for those that we have addressed in this report.
Understood. Okay, last question for you. What role can networks like ESSA play, and what opportunities does the report open, given that it's a tall order here?
I think that over the past 25 years, we've contributed a lot to changes that have happened in the early childhood education and care systems across different countries. But giving us as an example, but not only us, but other networks that are working in general in trying to create relevant changes or timely changes in systems and forward-looking changes. I think that's all equally important, because we are kind of so well connected on the ground that we can notice what are emerging needs or emerging challenges. Networks, I think, can turn the findings either from implementation, either from research, into action. So they are the ones that can perhaps more easily bridge policy with research and practice. As there's a lot, this cumulative knowledge that has a more of a bird's eye view across different countries helps a lot understanding of the landscape and the trends and what has remained as a constant barrier or a constant challenge, and where pockets of solutions have been created, but they not necessarily managed to be scaled, and so on. And I think for that reason, the networks are the ones that are bringing countries and different stakeholders in the system together. They are the ones that can translate those practices from one country to another, adapt them, contextualize them. So in the network, the valuable knowledge travels faster, and I would say that scaling is easily enabled, knowing that you trust that you have professionals that have an experience and expertise already working on the ground for a long time, and partnering with the governmental organizations and bodies, as well as knowing very well inside out, I would say, the systems. Also, the networks are by nature spaces for peer learning, but also a place for dialogue and reflection, because I think there's a lot that needs to be discussed, needs to be figured out, co-constructed. Notice what are the current, but what are the emerging challenges, so that we are better prepared to address them. So I think that the report opens doors for collaboration on different components of the systems in advancing what I was mentioning, this package of measures, from outreach models to integrated services, from inclusive pedagogy to monitoring participation and municipal level reform. So I think it gives countries a common reference point and perhaps a shared direction. And networks are the ones that can help them move forward together, bringing the know-how that has been capitalized over the years by working in communities that themselves have changed.
So the networks bring a lot of efficiency, trust, supports that otherwise wouldn't be possible or visible.
They are part of the ecosystem. So besides of the governments, local, national, civil society, also private organizations, they all are part of the ecosystems, and they all can play a role, either by bringing innovations, either by supporting scaling, either by compensating, for those gaps of capacity that exist at the local or national level. I think it's a matter of dialogue. It's a matter of coordination and a shared purpose and vision, where where we are heading and what would be the priorities on a short, medium, and long term. And all of them can play a role in making that happen. It's a question of who takes the lead and how far they want to get.
Mihaela, thank you so much for your time, for sharing with us these insights from the report, but more importantly, thank you for this important work you've done. It sounds like a huge report with a lot of very valuable takeaways for many of us who are part of the ecosystem to do our part, and also to help raise awareness about the importance of doing this and how to do it right, even if it's phased and imperfect and even with a limited capacity, there's plenty that can be done. So thank you very much.
I have to thank all those that have written all the reports that I have reviewed and all the research that has been already conducted. And I can only hope that the analysis that I have put up through the report just brings at least some good evidence of what could be possible ways of addressing the issue of participation, and that better plans will be put in place, flagging, some of the risks that exist and to try to avoid them so that we have forward-looking plans that can really, really address the issue of participation.
Thank you.
Thank you, Maya, also.